There are approximately 50 million people in the world that suffer from epilepsy, a disorder caused by the abnormal electrical activity in the brain. This makes it the most common neurological disorder in the world. Hi, my name is Maddie and I'm a senior biology student at Mount Aloysius College. In this video, I'm going to talk about the scientific processes of evaluating the efficacy of a certain medication in the inhibition of seizure activity in a rare form of epilepsy. All the information discussed in this video is based off of and taken from a research done by McMurray and Striano entitled Treatment of Adults with Lennox-Gastaut Syndrome, Further Analysis of Efficacy and Safety/Tolerability of Rufinamide. Before I get to talk about the science behind evaluating the efficacy of medications, in particular Rufinamide, I'm first going to talk about the disorder that Rufinamide is aimed to treat. As I mentioned earlier, epilepsy is caused by abnormal electrical activity in the brain. It is often characterized by recurrent seizures of varying severity and symptoms. Some seizures can cause the loss of consciousness, decrease in oxygen, increased heart rate, increased blood pressure, uncontrollable jerking and twitching movements, and loss of control of urinary and bowel movements at the time and for a short bit after. There's very many different types of seizures that I'll be discussing a little bit later, but some of them can have all of these symptoms. Some may have a couple and not the others. It depends on the person and the time that it is occurring. While epilepsy is known to be a common disorder, there are several different types of it that range in severity and commonality. One of the more rare and more severe forms of epilepsy is Lennox-Gastaut syndrome, LGS for short. LGS is typically present at birth, but lays dormant until about the age of 4. That's when most people with it are diagnosed. It is known to be a very severe form of epilepsy that causes different types of seizures that often consume the patient's life. The overall cause of Lennox-Gastaut syndrome is unknown, but is believed to be tied to genetics. With Lennox-Gastaut syndrome, intellectual disability can accompany it, whether it was there at the presence of birth or if it had been an occurrence based on, say, if the patient had a fall and suffered a traumatic brain injury. That would be when intellectual disability occurs after. I'm now going to discuss the few different types of seizures that are pretty common with LGS, as well as explain what the researchers mean in their article. It's because they use some different terminology than is typically used. The most common types of seizures associated with LGS are atonic and clonic-tonic seizures. Atonic seizures cause a drop in oxygen, increase in pulse and blood pressure, and the inability to move, causing the body to fall or go limp, which it also may cause a loss or decrease in consciousness. The part where the body falls or goes limp is mentioned in the article and in one of the graphs that I will be showing you and explaining to you. The researcher referred to this as a drop attack, which basically they just mean that the patient was either standing or falling when they had standing or sitting up when they had the seizure, which caused them to fall to the ground. The second type of seizure is the tonic-clonic seizure, which is commonly the most well-recognized and known type of seizure. It is more commonly called grand mal seizures. This is a type of seizure that you would usually see on like TV drama shows in the hospital, Grey's Anatomy or something. Those are the big ones. They cause shaking, jerking movements, loss of consciousness. They can cause like foaming at the mouth. It's not always like that, but it can cause that. There's a risk of choking associated with it as well. You can also fall when those hit, and that's pretty bad because you can fall and then while you're twitching you can hit your head, and that's how a lot of seizures can be deadly or result in a traumatic brain injury. All types of these seizures can cause bodily harm, brain injury, and even death, but grand mals tend to be the most dangerous forms of seizures. Now that I've talked a little bit more about epilepsy and Lennox-Gastaut syndrome, I can now talk about rufinamide, the drug that was evaluated in this study. Medications in the treatment of Lennox-Gastaut syndrome are very important, as it is a progressive disorder, and the patients basically build a tolerance to each of the medications, and a lot of the times they stop working and they will need a change of anti-epileptic drugs, AEDs, or they'll need a change of dosage or a change of combinations in order for it to work properly for them. So basically, rufinamide is one of the newer medications, and its efficacy is studied a lot. It has been found to be a little bit more effective than other oral AEDs, and it works as a voltage-gated sodium channel blocker, which basically it works by blocking the sodium from entering the membrane of the cell, which affects the action potential, which I will explain in just a second. I'm just gonna explain the basics. So say this is our neuron, and here we travel to the next neuron at the synaptic gap where they are communicating. These little green dots are to represent the sodium molecules, and the little red things right here are my attempt at drawing the voltage-gated channels. Basically, the way that rufinamide works is by keeping these channels closed and not allowing the sodium to pass through. By inhibiting the sodium's movement past the cell membrane, you are prolonging the action potential and not allowing for the stimulus to cause a reaction, and this is what is blocking the convulsions and keeps the patient from seizing. In this study, they took 31 individuals over the age of 18 with Lennox-Gastaut syndrome, and they split them into 2 treatment groups. 21 of them were put into the experimental group, and 10 of them were put into the control group. The experiment spanned over a 28-day baseline period, followed by an 84-day treatment period. This includes 14-day titration plus 70-day maintenance. The 21 individuals of the treatment group were given an increasing dosage of rufinamide from 1,600 milligrams to 3,200 milligrams a day. This dosage was gradually increased to avoid any negative effects. The control group received a placebo pill throughout the experiment. This, however, did not mean that they were receiving no AEDs. That would not be ethical, especially with this form of epilepsy. They still remained on 1 to 3 anti-epileptic drugs, as well as the treatment group also remained on 1 to 3 AEDs that they were already taking. Next, I'm going to show you the main figure in this research that sums up the data. All right, here's the first part of the figure. The black bars are the treatment group and the white bars are the placebo. As seen in the first comparison, the treatment group experienced a 31.5% decrease in total seizures, while the placebo group showed an increase. The second comparison shows the treatment group experienced nearly a 55% decrease in drop attacks, which is where the person experiences the fall along with the seizure. This is the second part of the figure. It shows the comparison of the response rates in the treatment group and the placebo group. The response rate is defined as a 50% decrease from the baseline amount of seizures that the individuals experienced. The first comparison shows that 33% of the treatment group experienced this 30% decrease in total seizures, while the placebo group did not. The second comparison showed that 57% of the treatment group experienced a 50% decrease from drop attack seizures, while the placebo group experienced a 10% increase. This figure basically shows us that rufinamide is effective in inhibiting seizure activity in people with Lennox-Gastaut syndrome. In conclusion, LGS is a very progressive epileptic disorder, which is very reliant on different medications and the efficacy of those. Through the scientific processes, McMurray and Striano, through their research experiment, found that rufinamide was efficient in inhibiting the seizure activity in 31 of the LGS patients. Any further research that should be done, because science is always changing and there's always ways to improve. The further research should include longer periods of time for the study of LGS, as it has the ability to cause the individual to become more resistant to the medication, and further research could also include studying the efficacy of rufinamide when used in combination with specific other AEDs. Thanks for listening.